move to our next presentation for today, and we will have Annette, who will talk about reducing the footprint of colorectal cancer screening in the Netherlands. So you can use this mic. And
my name is Annette van der Belen. I work in the Netherlands at the National Institute for Public Health and the Environment, and specifically at the Center for Population Screening. I will present the work done by my former colleague Iris. She unfortunately moved to work at the Ministry of Health, so that's why I'm presenting her work. So all the credits are for Iris. And I will talk about reducing the footprint of colorectal cancer screening in the Netherlands. First, I will tell you something more about colorectal cancer in the Netherlands and about the screening program, just to understand what we actually did on our attempts to reduce the footprint. After that, I will have some discussion points. Well, colorectal cancer in the Netherlands, we have a total population of 17.5 million people, and about 12,000 new cases are yearly diagnosed with colorectal cancer. The survival rate really depends on the stage at which it's detected. So screening is really helpful because it then we detect colorectal cancer or previous lesions in a very early stage. It's also a slow-growing cancer which makes it ideal for screening. The goal of screening is really to reduce the mortality by colorectal cancer. And we target people between 55 and 75 years old. In the Netherlands, they receive an active invitation. The whole package, you can see it in the picture here, is sent every 2 years to them. It includes a so-called FIT test. It's a self-sampling test kit, so they can collect their feces themselves and send it in for analysis in the lab, where they look at if it contains blood. If that's the case, then the people receive a referral for colonoscopy, because further examination is of course needed to see if they have cancer or not. This is how it looks like in the whole process, so it's quite complex. Well, we start with what I told, a selection and invitation of the people. Then they can use the kits for screening, and people get informed whether or not they have blood in the stool sample and they need a further examination. If so, they are referred for colonoscopy, and they get diagnosed or not, because it's still possible that they are false positive, and then they go into the surveillance program, and otherwise they receive treatment, of course. Then the figures of the screening program. We have a target group of around 2.2 million people in the age group 55 to 75, and almost 70% of those people participate in the screening program. Almost 5% are referred for colonoscopy, and 25% of these people are diagnosed with an advanced adenoma, and almost 4% with colorectal cancer. Well, then the part where we started to reduce the environmental footprint, it was mainly the intrinsic motivation of my colleague Iris. She really thought, okay, we could improve something, because we are sending a lot of plastic and paper to all those people, so there must be somehow ways to improve this. And she dived further into it, and she read that 80% of the total Dutch climate footprint comes from the government, and of that 7% out of Dutch healthcare, so that's quite a lot. We also have to deal with a really complex infrastructure it's depicted in the picture for the colorectal cancer screening program. So there must be many options to improve the sustainability. Well, we started with a life cycle analysis done by students from the Utrecht University, and they looked into where the biggest impact was. So they looked into the labs, the letter sent, the total invitation package, and they found that the global warming potential of the total of the tree was around 34, equal to 34 Dutch households. So that's quite a lot. And if they looked further into it, they saw that mainly the package had the biggest impact. That's also shown here, and it was quite a surprise to us because on forehand we thought maybe the transportation in the whole screening program would have the biggest impact, but that was really not the case. So the total invitation package, and it's as you can see here, it's a lot of plastic paper, it's the whole kit, and it's sent to all those million people over and over again every 2 years. So that's a lot of stuff. So what did we do so far? We did more things. We improved the user guide, so it would be less paper and less plastic in it. And also the return envelope was quite big, so it turned out that it could be a bit smaller. We also did some research in what kind of information was actually needed, because a lot of these people participate every 2 years. So they, after some time, they know what they can expect and know what the screening program is about. So it turned out that we could reduce the information package with 8 pages, and if you sum that up, it's like 300 meters of stacked A4s. It's like the height of the Eiffel Tower. We also started to use recyclable paper and plastic. Don't ask me why, but we didn't use that before. And we started the non-respondent project, and I will tell you something more about that. Well, we have many unused invitations. Almost 70% of the people participate, but all the people get the total invitation package. So 30% of the invitations and the tests which are sent out won't be used. So we started a pilot of about 2 years that people who didn't respond to the invitation package twice consecutive times, they will all only receive an invitation letter. So not the whole package, but only a letter. And they can, if they still want to participate, they can ask for the whole package. And I will show you the results we got, so I walk you through. Well, we have we saw that in 2020, it's the actually the control group, it's the normal procedure, and in 2021 and 2022, we had this pilot of only sending the letter. And we saw that the number of invitations we sent out and the number of people who 2 times consecutively didn't respond to the invitation started to increase. So it increased to almost 15%. And then if you look at the participation rates, we saw that in the control group, we had a participation rate of the non-responders of about 10%, and in 2022 it was only almost 5%, so the participation rate was halved. And what was also the case was that the relevant findings was a bit higher in the non-respondents. So we saw that people who didn't participate from themselves, it turned out that more colorectal carcinomas and advanced lesions are found in those groups. And also the non-respondents are known that they take less times the colonoscopy if they are referred. So it's practically a higher risk group compared to older people. We also looked into the savings, and as you can see here, the cost savings are huge, and also the savings in total plastic and paper we got are quite huge. It's varied. It started like more than 8,000 kilograms plastic and paper saved, to last year more than 11,000, and also the cost savings are really huge. But unfortunately, although these seemed quite nice, we also did some calculations on the lower participation rate in the non-responders group, because this is the higher risk group. And in the end, it turned out that that the savings we have because of this project, we don't have it on the long term, because these people are getting colorectal cancer or advanced adenomas in the long term. So in the end, they will need treatment after all, and they are diagnosed much later on. So the Minister of Health in the Netherlands decided to stop this project because of this, because in the end the savings turned out that it is negligible in the end. And also it was a bit a question what is our responsibility regarding the ecological effects of treatment. So it was quite a discussion between us and the ministry. But we, due to this project and also due to the investments of our colleague, we started to think about the environmental footprint of all the screening programs, because besides the colorectal cancer screening program, we also have a breast cancer screening program and other screening programs. So it really started us to think about our image and role model to outside, and and now we are looking into other possibilities also in the other screening programs to improve sustainability there. I would like to thank especially all these people for their work, because it's not my own work, and would happy to answer any questions if you have.
So here you go.
Thank you. Can you convert some of this screening process to digital communication? I mean, to save paper and email, for instance?
If we looked into that, you mean, or what do
Yes.
you mean? Yeah, we looked into that, but if you look at the, because we also have the pre and neonatal screening programs, which is among a much younger target group. So there we are much more working on digital communication. But in this, specifically in this age group, it turned out it's still a little bit difficult to get people participating. And actually, at the moment, we are quite struggling in the Netherlands with the participation rate in total, because after COVID, it is still declining in the Netherlands. So we are really putting all our efforts on accessibility of the programs, and that is not when we only send out digital communication. Yeah.
What about advertisements in the city and newspapers and things like that? Because in Sweden, There's advertisement now for prostate cancer test.
Yeah.
And it's actually, they made a joke of it because it's especially Christmas cake in Sweden, which has a shape of a, I should not explain it, but I mean, and that make a joke of it. And that was really successful because that put
it's quite a discussion because the basic in the Netherlands is that people have to rely on an informed decision to participate or not. And it's said that we don't have to push it too much, and advertisements, at least the ministry, they find that it's too much pressure on participating because there are also disadvantages of a screening program, of course. So, yeah, it's still a big discussion, yeah.
Yeah, thank you. So I saw on the slides that one of the statistics mentioned that 18% of the greenhouse gases comes from the government, right? The Dutch government. But
Sorry, that
18% of the carbon emissions comes from the government.
Yeah.
What is actually included in that analysis?
Oh, I'm sorry. I would have to look it up. I am not sure what it's.
No worries. We can
included.
follow up
Yeah.
later. Yeah. Thanks. Dankjewel.
Are there other questions? I think it is good, and thank you so much for the presentation.